I was doing a coaching call in our NP community a few weeks ago, and we're talking about business, social media stuff. And one of them asked me, "So, what do my patients think of me being on social media?" And I was like, "My patients find me on social media." And this contrast really hit hard for me when I was working in concierge private practice before I went full time into my own practice in social media. And so basically, I was getting assigned patients. And then when I was getting assigned patients, they basically would come in and they would have no relationship with me. So no expectation, but no relationship with me either. And when you go into psychiatric care, normally you're a little bit apprehensive. You might be nervous. You might be distrusting of the provider, especially if you've had bad experiences. I remember this one time, this lady, 40s, came in with her daughter who has autism, who is maybe in her mid teens. And the daughter has problems with agitation, aggression. And so immediately the mom walks in and she has this discerning look on her face. And I introduced myself and then she asked me, "Oh, okay, what medical school did you go to?" So I answered. Then she's like, "Are you qualified or what residency did you go to?" So I answered. And then she was like, "Are you qualified? Do you have the qualifications to treat my daughter? She's very complex." And so I sensed what was going on, right? And it said, "Listen, ma'am, right? Like I know that I look young, but I promise you I have the full classifications, right? I did a full psychiatric residency. I did a child and adolescent fellowship. Whereas when I get a patient from social media, they've consumed my content, whether it's on TikTok, Instagram, YouTube, live stream. And so now they come in already having a relationship with me, like in their head, not a doctor patient relationship, right? That's a very clear distinction, but like they have some knowledge of me. And so if they come to my practice, it means they already like me. Otherwise, they wouldn't come and want to work with me. So now I have the advantage that the patient already likes me. They chose to work with me. Just if you go to see Taylor Swift, you obviously like Taylor Swift in concert. So now if a patient comes to see me, that means that they are going to be more warm and receptive towards me. So the interaction is going to go better. It means that they are going to be more likely to trust in what I say. It means that they're going to be able to more likely to follow what I say. And that means they're more likely to get better with what I say. In the therapy literature, if we know that it's not the type of therapy that matters. For example, if you do cognitive behavioral therapy or dialectical behavioral therapy, as much as the relationship between the client, the patient, and the therapist.